Okay, another question I got on my recent video on weight gain in pregnancy. So how is it possible to have a healthy pregnancy for those of us who either lost weight or gained very little? I gained 5 pounds total and was 15 pounds down from my pre-pregnancy weight from my pregnancy weight the day after I delivered. So it's common to lose a significant amount of weight day 1 or day 2 after delivery. But let's talk about not gaining weight in pregnancy. So there's different ways to approach that. For anyone who is having trouble gaining weight, we need to follow the fetal growth to make sure the fetus is growing appropriately. By and large, even when any patient is not gaining weight appropriately, the fetus will grow fine, but there are cases where they don't. So that is an indication to get fetal growth ultrasounds to make sure the fetus is growing. The other thing is, if someone is not gaining weight due to not being able to eat, like with hyperemesis gravidarum, we've got to get nutrition involved, dietary involved, see other ways that we can get calories in them, not just so they can gain weight, but so they can sustain themselves and sustain the pregnancy. And again, like I said, even in those situations, most of the time the fetus is going to grow, but there are rare cases where it doesn't. So Ensure drinks, other drinks that I've prescribed or given to patients with nutrition and dietary on board to do anything we can to get calories in. Sometimes we have to do that, but it takes us looking into it and assessing it and trying to do things to resolve it or help with the situation. We can't just dismiss it. So to answer your question, yes, even if you don't gain very much weight, it's for some patients to even lose weight because of hyperemesis and nausea, vomiting, or pregnancy or other reasons. It is possible to have a healthy pregnancy, but it largely depends on what the reason is. And we have to find out what the reason is and then address it appropriately in order to allow the patient to gain some kind of weight via calories in order to sustain the pregnancy and sustain themselves. I was pregnant with twins. I started out at around, I'm trying to think, maybe 130, 135. I gained 12 to 15 pounds with twins. I delivered at 31 weeks. And I couldn't eat. I pretty much lived on mashed potatoes the entire pregnancy. But that's what I had to do to maintain what I had. And I really didn't gain much throughout the whole pregnancy. And within a couple days after I delivered, I weighed less than when I got pregnant. So acknowledging it, trying to making sure that we know why the patient isn't gaining weight or they're losing weight, and then managing it and addressing it appropriately are key. So any provider who's dismissing the fact that you're either A, not gaining weight, or B, losing weight is not doing their job.